everyone. Thank you so much for your patience. We had a few technical difficulties there getting online, but we're all here now. And we'd like to welcome everyone to our APAC Financial Wellness Initiative presentation today, Measuring Financial Outcomes, Health, Wellbeing and Wellness. I'm Mariko Braswell, co-founder and CEO of Move 78 here in Singapore. Today's discussion is our second of a three-part series on financial health, and we are very pleased to welcome three brilliant guests to discuss their work, focusing on three very different markets and different approaches: the US, Australia, and Bangladesh. Just remember, if you have any questions today, please feel free to enter it into the Q&A at the bottom of your screen. There is a lot of information for our panelists to go over today, and if our panelists do not have time to get to it, we'll be sure to follow up with you afterwards. Now I'll turn it over to my partner, Vinita Godinho of Financial Resilience Australia, who will introduce our topic and panel, as well as moderate the discussion. Over to you, Vinita.
Thank you so much for that kind introduction, Mariko. And hello, everyone. It's just turned afternoon in Australia, where I am. So I'd like to kick off the proceedings today by acknowledging that I'm coming to you from the lands of the Wurundjeri people of the Kulin Nation in sunny Melbourne, Australia. And I would like to acknowledge their elders, past, present, and emerging. The topic today is one that I'm absolutely passionate about. You're going to see me getting very excited about things like measurements and indicators. But without further ado, I'd like to have the panelists introduce themselves and tell us a little bit about their role in their organizations. I'll go in alphabetical order, starting with you, Alejandra, then you, Anik, and then you, David. So over to you, Alejandra, for a short introduction.
Great. Thank you so much, Vinita and Mariko, for inviting me for this fantastic panel. I am Alejandra Ruales, and I lead our financial health measurement work at the Financial Health Network, which is an organization dedicated to improve the financial health for all through research, consulting, and innovation. As an organization, we want to see a future where people, especially those who are most vulnerable, have financial systems available to be resilient and pursue opportunities. So in my role at the Financial Health Network, I assist organizations such as banks, credit unions, nonprofit organizations, and government agencies in developing and executing financial health measurement strategies using administrative data or survey instruments like the FinHealth Score, which is the framework that we developed, and I'm sure that we're going to be talking about a lot today. And really my role here is thinking about how organizations that are using financial health measurement as a tool, how they really are able to use this information to drive solutions, to think about how they inform the way that they develop their products, to evaluate their impact of their current solutions and develop new ones. So that's the main purpose of my role. I also lead our global financial health strategy and have worked in collaboration probably with many of the attendees of this webinar on understanding how we can approach financial health measurement at a global scale. So very excited about this conversation.
Good stuff. Thank you, Alejandra. That was such a great introduction, and I'm really longing to get a bit into the details of what you're doing. But before that, let me introduce Anik. Anik, a little bit about you from Bangladesh.
Yeah. Hello, everyone. So I'm currently consulting in the digital financial services domain of MSC. So we are a boutique consulting firm that's been in operation for over 20 years now. And we broadly focus different market segments, but with the common goal of enhancing financial, social, and economic inclusion. So how we work is that we partner with financial service providers, both in the private sector and also with regulators and government, to try to understand what are the needs in the market that need solving, not just in terms of product development, but also what government advocacy needs are required. So some of our projects are strictly with for-profit organizations in the private sector, while we also do a lot of social development work in the government sector and in the public sector, including assessing or monitoring and evaluating social safety net programs, designing training programs for the different kind of government initiatives, and also guiding discussions, webinars, forums on policy discussions, up and coming, emerging. So MSc has its operations across the world. It's a global organization, but I focus on the Bangladesh operations. That's where I'm based at. So I'm looking forward to share some of the views from Bangladesh today. So in Bangladesh, currently we are working with several financial service providers and fintechs in various domains, and also with the government to enhance the delivery of government services to the people, and also to digitize the payment services and payment channels. So yeah, looking forward to a lively discussion today on the topic of financial health, which is quite dear to us here at MSc, because we believe that in order to enhance or improve livelihoods or financial conditions, financial inclusion of people, these are the discourses that we need, especially in Bangladesh, where financial health is quite a novel topic, as we are trying to achieve financial inclusion for all our people. So looking forward to the discussion today.
That's great. So good to hear that from you, Anik. And, these measures that we talk about, inclusion, health, well-being, are so useful in a developing country as well as in a developed country context. And I'm sure we'll exchange lots of insights today. But last but not least, let me introduce David Ribar. David, a little bit about yourself.
Vinita and Mariko, thank you so much for inviting the three of us. I'm so looking forward to this discussion. My name is Dave Ribar. I'm wearing two hats in this discussion. So currently I'm the faculty director of the Child and Family Policy Lab at Georgia State University, where we use agency administrative data to lift Georgia's families and children, especially those in vulnerable circumstances, and those who are participating in assistance programs. Prior to joining Georgia State, I was a professor at the University of Melbourne in the Melbourne Institute of Applied Economic and Social Research, where I partnered with Commonwealth Bank of Australia to develop two really innovative scales of financial well-being that we'll be talking about later. And most of what I'll be talking about today is my experiences developing that scale in Australia, developing a companion scale also in New Zealand. Thank you, Vinita.
No worries. That's so great to hear, David. And, can't wait to get stuck into our next part of the discussion. So what I might do is ask you a question that's on the tip of everyone's tongues, I guess, which is, what is the measurement that your organization is focusing on, and why did you pick it from the multiple measures that are available? And I'll start with you, Alejandra, then go to you, David, and then come up with you, Anik. So over to you, Alejandra.
Great. Thanks, Vinita. So, even before thinking about the measures themselves, I just want to make sure that I say that we center these measures to develop this framework around the actual, or how we're defining financial health, which is that financial health comes about when your daily financial systems allow you to be resilient and pursue opportunities over time. So if you think about the definition, really, financial health is a composite framework that considers the totality of an individual's financial life. So thinking about how an individual is spending, saving, borrowing, and planning may impact their resilience in the face of unexpected events and their ability to thrive in the longer term. So keeping that in mind, we focused on 8 indicators of financial health that cut across these 4 categories that I described before: spend, save, borrow, and plan, and created a composite score that is based on 8 questions that align with these 8 indicators of financial health, resulting in what we call our FinHealth score, and 4 subscores within each of these 4 categories. I won't get into the details and the math and all of that, but this score goes from 0 to 100 and is segmented in 3 categories: financially vulnerable, from 0 to 39, coping from 40 to 79, and healthy from 80 to 100. And it is a simple average across these 8 questions, and that again are mapped to the indicators of financial health. And you asked a little bit about why these indicators, and I think that there's 2 main reasons. One is that we were looking for objective measures of financial health, And the second one is that there's many indicators, there's many data points that we can be looking at, but we wanted to keep the methodology and the framework simple to ensure that there was implementation and adoption across the industry. I'll go more into detail about what the exact 8 indicators are later on, but just if you think about it, like when we start thinking about a financial health framework or thinking about a survey instrument, we wanted to make sure that financial services companies, nonprofits, and others could use this as a tool to really think about financial health outcomes. And that's why we wanted to keep it simple and thinking about these 4 categories as overarching elements that influence someone's financial lives.
That's great, Alejandra. And I'd like to say that you've succeeded because you've made the definition so simple and easy to measure that it's actually informed the work of the other 2 panelists, which is David and Anik. But let me go to you, David, and find out a little bit more about what Commonwealth Bank has been doing in Australia.
So like Alejandra, I'll start with our definition of financial well-being. So we measure financial well-being through 2 different scales, where we define financial well-being as the extent to which people both perceive and have financial outcomes in which they meet their financial obligation, financial freedom to make choices that allow them to enjoy life, control of their finances, and financial security now, in the future, and under adverse circumstances. From that definition, we worked with both survey data and bank record data to come up with scales of financial well-being. And through our work, we developed 2 scales. One was a reported financial well-being scale, which is based on 10 self-reported items, answers to 10 questions about people's perceptions and experiences with their financial outcomes. And then a measure that really draws from the Financial Health Network definition, an observed financial well-being scale, which is based on bank records that describe outcomes from people's cash balances, savings, credit, and payment behavior over a 12-month period. The overlap with Alejandra's measure is that we really cover the first 4 items that are in the Financial Health Network, a set of items, but do it through a set of bank records. And I'll turn it over to Anik.
That's great. So nice to see how we build on the shoulders of giants, isn't it? And I don't want to say, Alejandra, that you're a giant, but really the work that you've done has been absolutely seminal in building the various measures. Over to you, Anik, as to how you've used these measures.
Yeah. So at MSc here, we mainly cater to the low and moderate income segment. So in Bangladesh, financial inclusion has not been achieved for majority of the population yet. So first, we're actually looking at 3 dimensions of financial inclusion, whether there is enough access, usage, and barriers. So in terms of access, it could simply be the population that owns bank accounts, but we go beyond that to look at what are the different kind of access points available, such as mobile money agents or agent banking outlets or bank branches, and what is the nearest access point to a person in any given administrative unit, no matter how remote they are, right? And we also look at usage, whether the account is lying dormant or whether there is some kind of activity, because we sometimes in our government policy, we have these specialized social safety net accounts. These are called 10 taka accounts, or 12 cent, if you will, in dollars. So these are just for receiving certain social safety net benefits with which you can't really do savings or take credit loans out of these. So they just on paper increase the financial inclusion, but what we call meaningful financial inclusion, that is not really enhanced, because we believe financial inclusion is not really binary. It's not on or off. So I think there's a spectrum that we need to discuss. And of course, we look at barriers, which include voluntary as well as involuntary. So the involuntary barriers are the systemic ones that I'll later talk about, but there are also certain voluntary barriers due to perception or maybe lack of awareness. So beyond financial inclusion, what we would like to also do and we often do with our private sector partners are measure financial health, and the indicators we use are exactly the ones that we have drawn inspiration from the Financial Health Network: spend, save, borrow, and plan. And we work with, the way we work with these is that yes, we do measurement to some extent, but we mostly work with these indicators to develop products with our financial service provider partners, such as credit products or savings products, etc. So the barriers I was earlier talking about, so understanding these barriers help us formulate advocacy policies for the government or the regulators, or design strategies. Like one example I could give is that it came out of one of our studies, finding that women sometimes have problem accessing mobile money because they want to interact with female agents, right? So we went ahead to the Bangladesh Bank, which is the central bank, and we designed a women agent acquisition toolkit consisting of a recruiting toolkit, recruitment manual, selection tool, training modules, etc. And Bangladesh Bank uses it now, endorses it, publishes on their website. So this is one small but very meaningful work that I believe we had done. So there are certain areas like this where we like to contribute. So yeah, I think I can expand the discussion further, but right now I want to head you over to you, Vinita.
That's great. Thank you so much, the three of you, for sharing a little bit about what you're measuring and why, what measures gets done. So, for me, I think that that's a really great way of summarizing the different types of things that we're building on from the work that Financial Health Network has done, which is fantastic. So the next thing I'm really curious about, of course, is what are the specific indicators you're using? Because everyone who's interested in monitoring and tracking always wants to know about specific indicators. So my next question is about specific indicators, but it's also a triple-barreled question. So I want to ask you, what are the indicators that you're using? What level are these indicators at? Are they individual or household or population level or global? And what challenges have you had in picking these indicators or measuring them? And to mix things up, I might start with you, David, because of your experience with Commonwealth Bank. So start from a specific bank's perspective. So over to you, David.
So the specific indicators that enter our scale on the reported side, it would be a set of questions that get at elements of our definition. So an example of one of the items that would be asked is, in the last 12 months, how difficult was it for you to meet your necessary cost of living expenses, where we then give examples of those expenses. And that gets at meeting people's obligations. In terms of outcomes referring to financial security, we have a question, somebody's agreement with the question, I am securing my financial future. One of the things that we tried to strive for in these questions was to make all the questions universal. So we don't ask about specific things like retirements, or to have people compare things to earnings. So nothing that would be situational, everything would be in terms of general financial principles. On the bank record side, we ask about, or we don't ask about, we collect data on whether people are experiencing payment problems with the bank. So for instance, whether they have overdrafts or overcharges, whether they've been late with a payment. We have a question about how long they sort of float along the bottom in terms of having low liquid balances, where they would be at risk for spending difficulties. We have a measure that takes a look at the number of months where spending exceeds their savings, spending exceeds their resources by a certain amount. We ask them about how long they could go, or we measure how long they could go with respect to their available credit and their available savings. And then we have another question about savings balances. There's been a two-track method subsequently towards measuring things. Commonwealth Bank has focused mainly on operationalizing the bank record scale, because they have access to those data and can work with those very easily. And the Melbourne Institute, because of its experience with surveys and through conducting other surveys, has focused more on the reported scale and asking people about their financial well-being. Commonwealth continues to collect some data on the reported side, and Commonwealth and the Melbourne Institute continue to collaborate with those measures.
That's fantastic. And it's so fascinating, isn't it? Not just to have a reported measure, but the observed measure. So to be able to observe how people behave vis-a-vis what they say they're going to do. So it's such a fascinating measure. And I'm sure we'll come back and talk a little bit more about what you've learned from that, David. But from individual to a slightly larger group that you're looking at, Anik. So if you could share with us some of your indicators, the level that you're looking at, and then some of the challenges that you might have had. Over to you, Anik.
Right. So in terms of indicators, I'd like to preface by saying that we do several different kind of projects. So it varies from project to project. Like when we do some kind of evaluation project for the social safety nets to see how much financial inclusion or health has been enhanced, then we do it at a district level. But otherwise, for most of our projects with the government, we do it at an individual level. Also with the financial service providers like banks or microfinance institutes, we also do it at an individual or household level at most. So the indicators that I will not go too far into the indicators that much, because I think we at MSc believe in the kind of cooperation and knowledge sharing, and we have drawn heavily the inspiration from other thought leaders or global best practices, such as Financial Health Network themselves. So we don't believe in reinventing the wheel, but some of the indicators that we often use for our social development and government related projects include some of the more basic stuff without what's their income, what's their expenditure, do they have any kind of bank accounts, do they have any savings account, do they have any deposit, what is their debt to burden ratio, credit risk, that kind of stuff. But one thing that we need to understand, that we need to contextualize or localize a lot of things for Bangladesh perspective, because some things like a credit rating or credit scoring, that kind of information does not really exist in Bangladesh. Not just for the low and moderate income segment, but even for the maybe more affluent segment, it's not really a mainstream thing. So we need to tweak some of these things and maybe just juggle with the weightage of different things. So when working with our financial service providers as well for maybe the digital credit product or something, so there we rely more on banking data, transactional data, right, that kind of stuff. But I would like to focus more on the challenges rather than our indicators, because I think that's where when the rubber meets the road and we need to find ways to overcome some of these issues. So something that we've seen is that the gender gap in Bangladesh in financial inclusion is massive. Until the recent reports, it was around 30. It was exactly 29 percentage points, meaning if 65% of the men in the country are financially included, then 35% of the women are included. So that's one of the largest gaps in the world, actually. And that made us realize that we need more targeted policies for women in Bangladesh. So there's a need for gender disaggregated data. And this need comes not only from the government or a policymaking perspective, but also for our private sector partners, our financial service provider partners, such as banks who want to maybe design a digital credit product or credit savings product for women. Because quite often what used to happen in our industry, it's still prevailing, is that when you want to target women, basically you just slap on a suffix like for women at the end of your product's name and that's it. But we need to look at individual needs, and we need to look at what are the different kind of financial health indicators or financial inclusion indicators for them. And that helps us understand kind of their demand. For example, one of the reasons why gender disaggregated data is important and why it is often not that accurately measured is because sometimes in Bangladesh, when let's say a device or a mobile SIM is registered in the name of a woman, but it's used, it's possessed, it's used by her family or her husband, a spouse, whatever. Same thing with a mobile money account maybe, or a bank account, because sometimes the government gives special kind of subsidies or loan interest rates for women that mostly in the rural or LMI segment, the men are in possession or usage of those particular things. So even when we conduct these kind of researches or measurements, we need to be very mindful about the methodology methodologies we use, so that we can kind of bring a more accurate measurement, because there have been certain doubts about this in the past. Because in policy making, we have this saying, I guess, that if you are not counted, then you do not count, you do not matter, and you are invisible to the policymakers or the decision makers. So I think this is why we stress on this. And this is improving. We are starting to collect gender disaggregated data ourselves, and in any kind of platform, public platform, with the government, with other private stakeholders, we encourage these kind of practices. And it's coming up as a dialogue at a national level, where think tanks such as even AFWI are considering like having some kind of a platform for this, and ensuring that gender disaggregated data measurement is one of the core mandates. There are also many other levels of disaggregation, but this is one of the main ones that we're focusing on, because as a segment that consists of 50% of the population, they are still kind of a minority and lagging behind. So this is something that is quite unacceptable on so many levels. That's why we're working on this.
That's so heartening to hear you say that, Anik, and describe the challenges of having nuanced data. Because, you know, you could have lies, damn lies, and statistics, as they say, in terms of data, but really getting to that next level of nuances so that you can see the differences between different cohorts. And gender, of course, is such an important one. So perfect. Thank you, Anik. And on that, perfect segue to you, Alejandra. Tell us all about your indicators and what the Financial Health Network has found.
Yeah, no, thank you. And also want to thank Anik, that's such an important part. And maybe this will come up later on, but it's just the idea of disaggregating data is really key, and it's something that we're very focused on, not only for the way that we evaluate our own data, but also the way that we push members that are part of our network when they're adopting the FinHealth score and they're using this methodology and they're using these indicators, really pushing them to think about this in a disaggregated basis, because that's when you really understand those individual needs. So thank you for bringing that up at the front and center of the conversation, Anik. In terms of the indicators themselves, I described before that there were 8 of them. I'll just kind of like quickly run through what they are and you know how the questions are formulated. I want to emphasize that the methodology and the scoring and the survey questionnaire itself is also available on our website. So anybody can download it and then look at the specific questions themselves. I just wanted to emphasize that. But the first 2 indicators are around this idea of spending. The first one is, do you spend less than your income? You know, for the second one, we're talking about the ability of paying bills on time over the past 12 months. Have you been able to pay your bills in the past 12 months on time? Then we go into savings. So the next 2 indicators talk about short-term and long-term savings. For indicator number 3, we say, do you have sufficient liquid savings? And it's almost asking the question around, at your current level of spending, how long could your household cover expenses without having to borrow money? So basically, with the money that you have readily available, how long you could go with covering these expenses. And then the second question, or I guess indicator number 4 on the save category, is around sufficient long-term savings, which is not just positioned as retirement accounts or something like that, but it's about, we ask it about long-term financial goals. So are you saving for a vacation? Are you saving to own your home? So we talk about that as like long-term financial goals, not specifically with retirement savings in mind, which is where a lot of people think about when they think about this indicator. Indicators 5 and 6 that are around borrowing. So do you have manageable debt when you think about credit card debt? And again, this is a lot of, or when we designed this was with a US-based context. We know that it has been adapted outside of the US, so I just want to emphasize that. But that's how we were thinking about this indicator originally. And then the 6th one is what Anik mentioned about what is your credit score? Do you have a prime credit score? Which is a very, very big determinant on financial health, not the only one. And in the US, a lot of credit decisions, a lot of opportunities to own assets are based on this credit score. So that's why it is a relevant indicator here. The 7th one is 7 and 8 are around planning. So the 7th one, we ask about if you have appropriate insurance, thinking about, at least in the US context, like health insurance, vehicle insurance, home rental insurance, life insurance. It's about the confidence about if these insurance policies will give you support in case of an emergency. which is important, but I will go into why that indicator could be a little bit, what we would be one of the challenging ones. And then the 8th one is, are you able to plan ahead financially? So, to the broader question around, like, I wanted to mention that these questions are asked around the context of the household, meaning that we ask the individual responding the survey to include themselves and others living with them who contribute financially into the household. Of course, questions like credit score, they're asking about the individual responding the survey. But also I wanted to mention that the Financial Health Network has taken this survey and created this framework and developed US-based national benchmarks. Using this methodology, we work very closely with partners. The University of Southern California, they have a panel, and we've been now creating these benchmarks for about 4 years. And so, we looked at a national level. We're able to disaggregate in different levels of age, gender, income. Most recently, our team has done a fantastic job about thinking other areas of disaggregation, such as sexual orientation, LGBTQI, and really to understand those specific health challenges around those demographic groups. And challenges, I also mentioned, the insurance indicator has been one that it's a little bit harder to study, just for different reasons. Just the way that you're able to evaluate that data on a bank account is not always super straightforward. So that's one that I think we need to do a little bit more research on. And then I would say that one of the other challenges that we could face is that we don't necessarily have direct access to the data like Commonwealth Bank would have, right? Since we're not a financial institution. So we rely on our partner USC, who has this panel, and some of the panel authorizes access to their banking account through a platform called, or through a partner is called Plaid, and we get access to their API to aggregate information just like across multiple providers. So I would say that could be a challenge because we might not always get complete information, and we might not, someone that has multiple bank accounts might not link all of them. So that's just one of the challenges that we have in terms of collecting the transaction data side of things. So just wanted to mention that as well.
That's great. It's so fascinating, isn't it? You put all of that time and effort into defining something, then you measure it, then you collect the data, then you try and draw insights from it. And sometimes it comes all the way back to what you're saying, Alejandra. Is that the right data? Do you need to then disaggregate? So you go through that whole loop again. And I can see that there are questions coming through from our participants. I hope we get a chance to go to them. But, this is something I really wanted to be able to talk to all of you about, given that we've got your time and attention now, which is the very purpose of collecting data and measuring things, is so that we can actually see what progress we're making and what are the key insights which others can then take action on. Because, it's not just your jobs to change the world based on your data. You're doing this so that you can then share the insights with others, right? So my next question is going to be, what are the key insights that you've gained through your research and measurement? And I'd like to start with you, Anik, because you're on the ground on your project in Bangladesh. I'd really like to hear what are the key insights that you've had. Then I'll go to you, David, and I'll end up with you, Alejandra.
Right. So I will speak of the key insights from some of the product development perspectives and some of the experiences that we kind of ran into. So the first, I will talk about, I think, one or two experiences. So one is that we have observed that we need to have a very careful or guided approach towards the concept of access to finance. So while borrowing or getting sufficient credit is one of the indicators of financial health, what we have often seen is that in Bangladesh, recently there has been a wave of what can you say, giving access to finance, both from a social or impact investing angle, and also from like a pure bottom line or profitability angle, right? Especially that these digital loans or digital credit, which are not that thoroughly vetted, and the credit rating algorithms are still quite young, I would say. And also sometimes some of the new fintech players have certain, maybe a bit murky or sort of gray terms or conditions that people don't really understand that well. So what happens as a result is that sometimes people take loans and they're unable to pay them, maybe because they did not understand the terms of the loan, they did not properly understand the interest rates, or maybe they are not even properly aware of the consequences As a result, what happens is that even for a very nominal loan, maybe of a few dollars, if I say in US dollars, for not paying, for non-payment, you can actually get blacklisted by the Credit Information Bureau. And what happens after that is you and your entire household who is dependent on you financially, their lives are crippled for a long time. So consumer protection is one angle that we really emphasize, that when talking about financial health and maybe credit particularly. I'll also talk about savings and insurance if I have some time. So this is one thing that we need to speak about. So in terms of product innovation and in terms of measurement of financial health in that angle, in addition to those, what we need is some kind of awareness building and financial literacy training for our segments, for our population segments. And also it's kind of not necessarily a correct conception that maybe in Bangladesh, it's just the low and moderate income segment or the rural segment that need this. But no, even many of the urban or educated or affluent segments, people who you would assume are educated and do not necessarily have financial literacy. We have seen this time and time again in our studies that financial literacy and literacy or education, as we know, they don't really go hand in hand that well. And financial literacy levels also vary by the type of product that you're dealing with. So when we have some kind of new or innovative credit products in the market, we need to be really careful of what they can do, because we've seen examples of M-Shwari in Kenya and what that can do to people, right? So that's one area. Another area that I just want to briefly touch upon is that in Bangladesh, we have some very interesting nuances that it's 86%, almost 88, 90% Muslim majority country. So religion sometimes plays a big role in people's perceptions, not necessarily because of the religion itself, but how they perceive it. I'll give a very small example. Insurance in Bangladesh, the uptake of it is very low, about 0.5 to 0.6%. And some of the research that we have done, it's very early work because insurance research in Bangladesh is also very premature, but it's not necessarily that the regulatory guidelines are not there or the industry is not competitive. Certain people don't see this as a very viable product that coincides with their beliefs. They believe, they have some kind of notions that it does not coincide with their religion. But at the same time, we see that in Saudi Arabia, the insurance uptake is more than 80%. So it's not really a religion thing, but it's more of a people's perception about that things. So this is something that we need to maybe talk about, and there is room for maybe translation, which I'll touch upon in just a few seconds. But at the same time, MSC, we are also working with our neighboring country, Vietnam, and we're working closely with the government there and a mobile money provider to provide insurance solutions. So we can see that it can be done in similar markets. So the challenges for insurance in Bangladesh are very, as Alejandra kind of pointed it out, insurance is very difficult to measure, and also insurance products as a result are difficult to design. So because we have very poor understanding in Bangladesh about this, but it's enhancing, it's increasing step by step. The kind of sequence or customer journey we're seeing, or industry journey we're seeing in Bangladesh is, first there was the development of the payment ecosystem, and then the savings, credit, and insurance will be the next big thing. But right now everyone's a bit obsessed about credit here. So the last thing I would want to touch about is that even in terms of credit, we see that people have a preference towards Islamic banking, and people have a negative connotation with the term interest for savings account or even credit for a variety of reasons. There's no issue with that. That actually shows that there is a huge addressable market for Sharia-based financing. Recently in Bangladesh, for the first time, Sukuk-based bonds were released. It's kind of the Islamic Sharia version of a bond in the capital market, finance market. So these things are emerging. And if you see Indonesian market example, the market size or the market share of Sharia-based financing is increasing. So this is just a kind of contextualization or a tweak that should be done in this kind of perspective, because as I was mentioning earlier when I spoke, there is some kind of involuntary financial inclusion and voluntary financial inclusion. So sometimes when you have the product, when you have this loan product, you're eligible for it, you can get it, but you don't want to get it just for some kind of a belief, which is important to you. It kind of borders on voluntary exclusion. So you can actually help these people get included by designing the products that kind of fit with them. And it's not a very difficult thing to do from a technological, infrastructural, or even regulatory perspective. The most difficult part is just doing the extra work of understanding the needs and the pain points of these people well, so that you can design these products. And then maybe when we measure again the financial health of these people, that they're not getting finance, we can see that maybe some of them were eligible for finance but were not taking it. So even our measurements can sometimes lead to some certain funky results. So these are certain challenges that we've seen that, or rather insights that we can work on. I don't really see this as challenges, but opportunities for both players within Bangladesh as well as globally who are working in these type of segments, because these nuances are not necessarily unique to Bangladesh. They're present in many other such markets. Right.
You're so right. You know, Anik, at the heart of everything you said is human-centered design. And humans are, you know, in many ways different in terms of their preferences all across the world, but in many ways they're also similar. So one size does not fit all. And, you know, you've really beautifully explained the importance of human-centered design, but I don't want to take up too much of time from David. So David, tell us about your insights with the work that you've done with CBA.
So I'm going to talk about three insights. The first is that we took a completely data-driven approach to developing our scales. So we worked with both survey data and bank record data, but we didn't force feed the survey data into one measure and the bank record data into another. This was something that the data actually showed us, was that there are distinct scales, closely related, but distinct scales of people's reported or subjective financial well-being, and then the objective conditions that give rise to financial well-being. So we have measures that are related but distinct, but the rigor of our approach leaves us very confident that we've got measures that have those properties. A second insight, and this shows up with both of our measures, is that both measures are related to standard things that you'd expect, like income and education. So higher levels of income, higher levels of education, more underlying resources improve both types of financial well-being. But the associations are relatively modest. And the things that are much more important are people's financial behavior. And the positive message that comes out of that is that financial well-being is accessible to people at different levels of economic advantage and disadvantage, that behaviors can make a difference. And one other insight that came out, and this is something that you can only get from using separate measures, is that there are some things that appear to improve what people report about their financial well-being that are distinct from things that contribute to their observed financial well-being. And one of those things is people's confidence or self-perceived financial knowledge. And it turns out that confidence can get you into a lot of trouble. So confidence is something that raises people's reported financial well-being, their subjective financial well-being. But it turns out that it's negatively associated with their observed financial well-being and what you see. And I think that has a lesson for financial literacy programs and other programs that we may want to be teaching a little bit of humility. Just not only teaching what we know, but some of the uncertainties about what we don't know and what we can't act on.
That's fantastic, David. You've just given us three absolutely beautiful insights, which I'm sure we can use in any context that we work in, which is, behaviors matter, overconfidence can be a dangerous thing, and basically recognizing the unique contribution that CBA has made through your very rigorous approach of introducing an observed measure, which I think is the first in the world, if I'm not mistaken, David, having that kind of an observed score for financial well-being.
I think it's the first that uses scale approaches. So I think it's the first rigorous multi-item scale.
Well done. That's a fantastic achievement, I think, David. And, I'm sure we'll build on that. But over to you, Alejandra. You've got such a fantastic wrap with all the work that you've done. Share your insights with us.
Yes, difficult to follow both David and Anik on this one. So I'm just going to take it at a, maybe more like at an action oriented, right? Like what do the insights tell us and how we can use them to drive action. Like key insights, you could read the reports that we've written about, year over year, we know that the US population is not financially healthy. Again, we have honed in the past 2 years in really understanding the disparities in financial health based on demographics, particularly race and gender. Anik attributed to the importance of looking at disaggregation. So we've been doing that. And in that process, I think we have been really thinking about how to open the door in finding equity in financial health and really highlighting the disparities and the needs of certain demographic groups when it comes to financial health, because it's very easy to generalize and say the US population is not financially healthy. Let's really hone in. And the reason to do that is because that's how we're able to, or this measurement data is able to help us bring a call to action to the policy, to private sector, to financial services. And I just want to give, two quick examples. Last year in the middle of COVID-19, we saw that low to moderate income workers struggled heavily compared to other non-frontline workers, financial health wise. We knew that LMI frontline workers, so those that were taking care of all of us, making sure that we were safe, that we had what we needed, were 5 times more likely than other LMI workers to report having someone in their household test positive for COVID-19, at least at the time of the survey. So, beyond the health and emotional well-being and this significant difference, there's some financial health ramifications, which means that these families now could not work. They did not have access to income. We probably know that already some of those families didn't have consistent income, so that's bringing a huge burden for them. As part of the survey too, we saw that 29% of LMI workers spent down their savings because they just had to, right, during this time. So, and of course, like the ramification there, thinking about the indicators, is that this reduces the cash buffer to support emergencies. So this brings us back to when we think about solutions. So what does this tell us? Is that solutions should be focusing on rebuilding savings and improving cash flow. It is really where we use this data to bring a call to action to employers, to financial institutions, to policymakers, to address financial health needs that are specific to frontline workers by accounting that they have variable incomes, that they have greater healthcare risks, that they have childcare responsibilities. So here's an opportunity to say, as an employer, can you offer an emergency savings account? From the policymakers, is like, let's pay attention to these additional costs that the frontline workers have, and what can we do about it? So that's where I wanted to drive these like key insights, right? We know a lot of the data, we know what a lot of the data is telling us, but the key insight is really how do we purposefully use this data to drive action? And that's why the tool that we have, we've seen a recent adoption, and we've seen it adopted in very different levels. We've seen it adopted across the globe, which is fantastic because it just gives us an opportunity to have a common language and call people to action and call organizations to action and say, this is how you design a solution for a very specific need. And at the end of the day, again, taking one step back, when you think about who are you talking to or who are you showing this data to? Is it a bank? And can you say, if you make your customers financially healthier, can you drive additional revenue? Is there a relationship between financial health and your business KPIs? And I think that's when you start seeing a lot of these, like, what happens after you measure. And that's like, I think one of the biggest insights and something that we're working towards building this business case for financial health as well. So it has to be a win-win-win for everybody. And that's what we're working, and we know the importance of that. So that's, I guess, a key insight, that it can't just stop us collecting data, but also how it drives action.
Such a timely observation, Alejandra. I don't know if you've been seeing the questions that are coming through from participants who are listening in, but a lot of what you've talked about is addressing some of the questions, which is what's the business case? Why should anyone bother? And I guess what I'm taking away from what you've said is that every part of society, whether it's the government and policies that they design, or it's the industry and products and services that they design, or the community, which designs support products for those who are disadvantaged, everyone has a role to play in ensuring the financial well-being of individuals and households. And your data is helping them to see what that role is, which is absolutely fantastic. So you're giving me goosebumps, but that's just me because I'm a nerd. So I quickly wanted to ask you a question, which is a burning question for me, which is, many of you are individual measures is what you're looking at. You're then extrapolating out to a household and then taking it up to the population and even sometimes global. So what are the challenges in extrapolation that you found? I think that that's a really key question, and I know we're running out of time, so I hope you'll be a little patient with us and give us a few more minutes to explore this really important question with our panel. And Alejandra, I'll start with you, given you have the longest history of extrapolation. What might you share with us in terms of your insights for the difficulties in extrapolating data?
Sure, I'll keep it short, and I'm sure that David has also a lot of insights here. I think a lot of it is in individual conditions, thinking about demographics. Anik mentioned this as well, like depending, like regionally, there could be a lot of differences. There, of course, globally, there's different contexts that you need to consider. And again, thinking about composite metrics particularly is, again, I mentioned this idea of creating a common language that sounds very nice in an ideal world, but in practice, realistically, you have to, creating a composite metric requires validation and just to ensure that the context is relevant. So yeah, I would say those are some of the challenges realistically is having this validation about the metrics that you're constructing and making sure that they're able to be scalable. And then I guess like the third one is also the data collection, data integrity. As you scale these efforts, it becomes harder and harder to ensure that the data integrity is there.
That's fantastic. Thank you, Alejandra, and so useful to know. David, I might ask you about your insights on extrapolation.
So, many of the measures that Alejandra talks about are universal things. These are basic functions of finances. And as we've seen in study after study, so, from all of our work, but if you go to other work like the portfolios of the poor, you see the same types of functionality that need to be carried out for people to live good financial lives. The thing that we learn, though, is that context is critical. And this is also something that the portfolios of the poor teaches us, that while there may be functions, there are going to be different types of institutions, different types of opportunities. They're not all financial institutions, and they're not all necessarily financial products that people use. And what that means is that the way that you measure something in one country may not translate to another country just because of the institution. So for instance, in the US, the planning element that Alejandra talks about is critical. You have to have insurance here. And people worry and go bankrupt because of lack of health insurance. In other countries, this is not the case. So at least in the Australian case, in the New Zealand case, nobody goes bankrupt because of a lack of health insurance. It doesn't happen. Those institutions are going to affect the way that things get measured. And if there was a key thing to somebody who's thinking of developing a measure for their country, please borrow all the questions and good ideas that you're hearing tonight and that you'll hear in subsequent lectures, but you need to test and validate your measures within your context. There are things that are going to work, but within certain contexts, there are things that are just not appropriate and that will need to be tweaked.
You're so right, David. And talking about context, I know we're running out of time, but I can't help asking Anik one last question. The context that you are in, Anik, is so unique. give us your challenges in terms of extrapolating data.
Yeah, I'll try to keep this brief. So we as an organization, we have in the past we have successfully, and in the recent past we have kind of failed to do a nationwide financial inclusion kind of index. The only kind of reporting for financial inclusion in Bangladesh, there are three major sources, and there's a lag in data of all of them. One is Bill and Melinda Gates Foundation's Intermedia. Another is the World Bank Group's the Findex report, last released in around 2017 it was, and also MSC's Agent Network Accelerator Survey, the ANA. It was last released in 2016. So back then we did a pretty good job, and it was quite extensive. But in recent years, we have tried to replicate that using kind of leaner methodologies like we do for certain other researchers, where we kind of do a baseline nationwide, then we do some district level researches for validation, and we see that we can easily extrapolate these kind of things. So when it comes to financial inclusion, we have not succeeded in that, unfortunately. So we have seen significant deviations across regions. Like there are certain districts such as Sunamganj, Khagrachuri, Netrokona, Kurigram, which are financially lagging behind compared to the other districts. And the interesting thing is that we tried to categorize them, but even that did not really end up well. By categorize, I mean, let's say I named Khagrachuri. It's a district in the Chittagong Hill Tracts. So I tried comparing with other Chittagong Hill Tracts districts, but again, there was a lot of differences. I tried comparing Kurigram, dry, arid North Bengal district with Rangpur. Did not work. Tried comparing the flash flood-ridden wetlands of Sunamganj with the neighboring districts. Again, issues there. So the conclusion that we came to is that financial inclusion data, at least the indicators we measure, are for some reason very diverse, and it's very difficult to extrapolate to a national level from the district. So what we have been suggesting or advocating for, and A2I, the government's think tank, they're also kind of on board with that. They also want to push this agenda. We want to go for a district level scorecard of financial inclusion scorecard at a district level. So why I'm talking about financial inclusion and not financial health, because as I mentioned earlier, we are still at the level where we're trying to achieve that level of financial inclusion before we can start discussion on health. So this district level scorecard, I think, is very important, because many people have tried, organizations have tried that nationwide financial inclusion measurement in Bangladesh, but no one's been able to hit the bullseye in the last few years. It's been proven quite difficult. So the district level one will provide policymakers better targeting, and also it will also give, I think, private sector companies kind of better idea on better data, some kind of better context just based on a person's district or where they're from. It will give them a lot of insights about that person, even if they're unbanked or they don't have a lot of documented records of that person, right? So before I just finish, I just like to add one thing, that it is quite often a conversation, because we are having these webinars, these seminars with the regulators and the private sector bodies together, that when we talk about this district level financial scorecard or financial inclusion scorecard, quite often what the economists have to say, they quote Goodhart's law that, a measure stops being a good measure when it becomes a target, right? And on the other hand, the private sector players are saying, but without objectives, without actionable targets, how can you get anything done? So we need to, that's the area where we work at, striving to find a balance between the two, because I think it's very necessary. Both the perspectives are very important, and these are very careful lines that we need to tread while we are working and developing this system, both for the social cause and also for the private sector. So yeah, that's I guess I took a bit of more time for that. So over to you, Vinita.
Not at all, Anik. Your insights are so fantastic. We could talk forever, but I know that we're running out of time. So I'll just stop at this point and thank all of you for your fantastic insights. For me, the three key takeaways from today have been that no matter what the measure, it actually has to work for the user. If it's not relevant to the user's life, whatever that context of the user might be, then the measure is no use. The second I've learned is that income matters, but what matters more is behaviors. So there's hope for all of us, no matter where we are on the income spectrum. If we can change behaviors, we can improve financial well-being, which is fantastic. And the third one is that extrapolation is difficult. Measurement is difficult. difficulties in consistency of data, on measuring data, but you still have to, put your neck out. You have to start somewhere. And on behalf of the Financial Wellness Initiative, I just wanted to end on a note before I hand over to Mariko, saying that we are actually building on the shoulders of giants like yourselves and taking baby steps towards creating what is financial wellness across the region as a whole, or Asia Pacific. You can imagine the difficulties of extrapolating data across multiple countries with multiple measures, but we are going to put our first attempt on that very bravely by the end of the year. And we hope that all of you will be able to contribute towards our first tenuous steps towards financial wellness in the Asia Pacific region. So I'll hand over to my fantastic partner, Mariko, to formally end today's webinar.
Thank you so much, Vinita. And what a fantastic and informative discussion. So impressive and just wonderful to hear all of your insights all on one screen here. We're so grateful for all of your time. Thank you so much to all of our panelists and audience, especially our friends joining us at less convenient hours. And also stay tuned for our information on our third event coming up of this series towards the end of September. And it will be on the public and private sector's role in financial health. If you'd like to stay up to date with the APAC Financial Wellness Initiative and learn how you can participate, please reach out to us through our page on LinkedIn, and we'd love to collaborate with you. Great, thank you so much. We'll see you soon.
Thank you.
Thank you for your time, everybody.
Thank you, everyone.
Thanks so much. Bye-bye.